Good morning, everyone. And today in diagnostics, we are talking about imaging. So, imaging, it's a very comprehensive topic, and that's the reason it's a specialty itself, which is called as radiology. And this radiology basically bring a huge change in medicine that help us in diagnosing many conditions nowadays. So, of course, we are not going to discuss this at the level of radiology. Rather, again, we are discussing diagnostics. So you are going to study a subject radiology in which they are going to give you more insight about this condition, about this field of medicine. But being a medical student, you must have the basic understanding of radiology or of the x-rays, for example, of the ct scans, uh, and about the mris, for example. In this lecture, we are going to cover the things about the X-rays, about the CT scans, and about the MRIs. The thing is that we are going to talk about how to interpret the X-rays, how to interpret the CT scans, and we'll talk about superficially about different conditions which can be catch on the X-rays or on the CT scans, and of course the MRIs. Of course, like I'm going to start my discussion with X-rays, and I'm going to discuss about how to interpret X-rays, especially you can say when you are working in the emergencies, when you're working in the medical wards, when you're working in the surgical wards. One thing which I want to make clear before starting the discussion is remember we go on the investigations uh, based on the sign and symptoms or clinical scenarios. So that's the reason the interpretation of the x-rays or the imagings are done on the clinical scenarios which are presented to us in everyday life or everyday practice. So now the important thing uh, is like these imagings guide us a lot towards the diagnosis as well as towards the management decisions. So remember one thing, that we always see the imagings in context of the clinical information which we have, and then we interpret that, and then we um, like decide what other lab diagnostics we have to go for. So now to start with, I would like to start with X-rays, and I would like to uh, discuss how X-rays help us in um, what you can say in different things. So better to start with chest X-ray, very commonly performed, or how to interpret a chest X-ray. Now, why I'm starting from the chest X-ray, because chest X-rays are the most commonly ordered investigation in the daily life. Now, what I'm showing you is a normal chest X-ray. So the chest X-ray is the single most requested imaging investigation in the daily practice, and in the undergraduate exams, most commonly the licensing exams also, what they ask you is to interpret chest X-rays or sometimes abdominal X-rays as well. So now, how to be confident in talking about or in deciding either the X-ray film you are seeing is what we can say is a normal chest X-ray, or how to catch the abnormality. And remember this thing, that X-ray it's a two-dimensional representation of a three-dimensional structure. Okay, like of course, like this is the X-ray film which you can see. So the body is a three-dimensional structure, but um, X-ray is basically a 2D representation of a 3D structure. For example, we can see the heart, we can see the lungs, we can see the bones, we can see different soft tissues. For example, this one is the liver, right? So X-rays is a two-dimensional representation of a three-dimensional structure. Okay, now I am including one more X-ray over here, okay, which is again a normal X-ray. And see, this one is without any, you can say the markings, but this one is with the markings. And you can see over here that they are showing you different structures over here. Now, how to interpret that thing? I would like to talk about something to build up the concept in you. You have to remember whenever you are seeing the X-rays, so what you can see is like the different shades, ranging from the black color to whitish color. Okay, so what we can see is shades. Okay, so these shades basically represent four different natural tissues, and one is for artifact. For example, I will tell you right now, the bone is white. Okay, the gas is black. Okay, so see, the bone is white. Okay, or here it is white, and the air, here you can see blackish area, the air or the gas is black. Now the soft tissues like muscles, they appear gray. Okay, for example, you can see over here where the lungs are there, they are appearing gray, or these are muscles over here, so they appear gray. Now one more thing, fats or fats is dark gray. Okay, so see, like again it's a different shade simply. And most of the man-made things are bright white. Okay, so you can see over here L. So what they do when they take an X-ray, they put a metal piece just to show this is the left side and this is the right side. Okay, so see, this one appear too much bright white, bright white. So simply, bone is white, gas is black, soft tissue is gray, fats are dark gray, and man-made things are bright white. Okay, now first of all, before starting any interpretation, what we see, obviously not seen over here, is what you can see simply here is left and J. But nowadays, what you are going to see when you are going to interpret X-ray, for example, you can see like this one is like I'm magnifying for you different structures. Now you can see over here, see, can you see this whitish areas, this whitish rings? Of course, like these are the man-made things, right? And here, like basically they are sutures. Okay, okay, so now what I wanted to show you here is especially in this one is they put R over here, right? And this one is inspiration, like this X-ray is taken during inspiration. Okay, so what I was saying is like when you are going to see any X-ray, like nowadays, because it's the like nowadays what we get is digital X-rays. So You will mostly found the name of the patient, the age of the patient, the date of the birth of the patient, the date taken, and the film number as well, like in real world, right? When you will see in the hospitals, always check the name of the patient, the age of the patient, the date of birth, for example, um, the x-ray date, and all those things, right? And then the second thing you have to see, uh, the technical factors of the film. For example, uh, what they do is like same like this x-ray. I'm going to put it over here just for you guys. What they do is like they write over here the sites, for example. Okay, then they write, for example, this one is taken in inspiration or expiration. Okay, so most of the lecture, what you can say, x-rays are taken in inspiration. Okay, uh, so you can found over here like inspiration, expiration, things like this, right? Like what was the state of the patient when they have taken that x-ray. Okay, so and then of course like we interpret the x-ray based on um, like the scenario in which they are taken. Now one thing is projection. Okay, one thing which we know is called as projection. What is projection, or what are the types of projection of x-ray is basically um, okay, what are the types of projection which we can see is one thing is called as posterior or postero anterior. We call it as PA, postero anterior. Okay, so basically this is, you can say, what we call it as gold standard projection. Okay, now why it's called as a gold standard projection, because in this one uh, the x-ray tube is behind the patient and the film against the chest. I want to show you over here. PA view x-ray, PA x-ray. Okay, so see, like these are all posterior anterior x-ray. um, Wait, machine. Okay, maybe they will show us how they take the x-ray. Yeah, like this one. So you can see over here in this one, basically the x-ray, the film is here, right? The x-ray film which I'm showing you is here, and the x-rays are falling on this person from behind. Okay, so you can see the x-ray tube or x-ray machine is basically this is all is x-ray machine, so that's why it is better to call it as x-ray tube, is behind the patient and the film is against the chest. So this is how we can take uh, posterior anterior view or PA view. Okay, this is the basically the gold standard. Okay, uh, and now of course like there is AP view, like in which, for example, like this one. See, now the film is over here, but the X-ray tube is over here. So this one is anterior posterior. Okay, so you can say like one of the thing is um, antero posterior. Okay, or what we call it as AP view. Okay, so this one, in this one the X-ray tube is in front of the patient and the film is on the back. Now there are many others things which projections which are used. For example, supine. Supine means of course the patient is lying on their back. For example, this one is supine X-ray, right? So all this interpretation is very important. One thing is called as erect. Okay, like Now erect, we know like the person is erect or standing. Okay, this is erect, that one is supine, and one thing is called as semi-erect. Like for example, I can show you this one. Okay, if you are going to tilt it more, so of course it will be semi-erect. Like the person is I like semi in the lying position or in the mid position, like not supine, not erect, semi-erect, right? One of the thing which is also used is called as mobile. Okay, so uh, this is basically when the X-ray has been taken with a mobile X-ray unit. And in the like this one is like done in very sick patients, like the persons who are in ICUs, in intensive care units, in coronary care units, okay, or in what we call it as high dependency unit. So simply like very sick patients, we can do a mobile X-ray. And of course, like there are portable X-ray machines nowadays, which they can be taken over there, and we can take this thing. So now these descriptions are very important. By why? For example, an acutely unwell patient who has a chest X-ray taken in an intensive care unit. Okay, so ITC, intensive care unit. Okay, now maybe that film can be taken in a semi-erect position, and that film will be AP view, not a PA view, because PA view mostly is done in the patients who are standing, right? Okay. Now, uh, why this interpretation or why this thing is important? For example, uh, the change of the position basically change the parameter or change the impression of the abnormality. For example, uh, the mediastinum, the mediastinum, okay, uh, appears more wider on a AP chest X-ray or a AP view, anterior posterior view, okay, which can give you the impression of pneumothorax, okay, or maybe the pneumothorax you can miss because of that, okay, or you can say like the pneumothorax can be missed when the chest X-ray is taken in supine position rather than erect position. Okay, so things like this simply. So that's why this is very important to know, like what is the position of the patient, or what is the projection of the film, or you can say this is the technical details of the film. So now how we assess the film in detail. Now, I will tell you that it's better to go into a systemic approach, okay, uh, when you are interpreting a chest X-ray, especially. Now, like, of course, whenever we go for a clinical examination, we go into a systemic way. First of all, we do go for inspection, then we go for percussion, sorry, palpation, then percussion, then auscultation. So, of course, like when you will be going into a system in a systemic way, if there is less chances that you are going to miss anything or miss any detail. That's the important thing. So it is very good, like in our medical school, they used to teach us how to explain chest X-rays because we have to appear in multiple vivas. So uh, you can say, uh, okay, if you can see a clear-cut abnormality in front of you, of course you can say it, but uh, you can say like the you can tell about, okay, number one, uh, what X-ray is this? Like this one is a chest X-ray, of course. So the second thing, the name, the age of the patient, all those things, and then you have to talk about the view. Like this one is a PA chest X-ray or posterior anterior chest X-ray. Okay, this thing. And then you can say like the chest X-ray quality is very good, because some of the chest X-ray qualities are not so good; they are rather bad. Okay. Then most of the examiners, by the way, when you will go for different examinations, um, they also want the candidates or the medical students to go in a more organized fashion. Okay, and it's not like this: if you found one abnormality you must stop. Rather, you have to search and see all the areas, and that's why I included one more X-ray in this slide, that is this one, or these are called as the areas to review, or areas which should not be missed. Okay, of course, like I'm going to come on this X-ray in a while, but just wanted to tell you, like, see, these are the special review areas. So anyhow, going back to the normal X-ray, uh, the structures which we have to interpret or which we have to assess when we are examining the chest X-ray. Um, Now here there are the name of difference. Like this one is the hylium, this one is the carina. There is trachea. You can see there is this one is the spinous process, clavicles. You can see. You can count the ribs. This is the left ventricle. This is the right atrium. This is the right hemidiaphragm. This is the left hemidiaphragm, and this one is the costophrenic angles. Costophrenic angles, right? Now you can see, like, this one is a X-ray of a female, and you can see her breast here and here. Okay, so see the breast tissue. So breast is soft tissue, right? So you can see like slightish grayish color. Okay, you can see over here. So the structures which we have to assess on the chest X-rays is heart and the major vessels, lungs and pleura, mediastinum, like, which means like you have to see both the iliums, okay, heliums, and bones and the soft tissues. Now you can see over here, you can see the right helium and the right pulmonary artery. You can see the left helium as well as you can see the left pulmonary artery, right, over here. Now, there are some areas which we call as review areas. So, always look at the costophrenic angles here and here. Always look at the two apex. Always look behind the heart, okay? Behind the heart, like in this area, okay? Always look below the diaphragm. This is diaphragm, so look below that. I will tell you why it is important. And always look for the breast tissues in case of females. For example, now see, this is a person who is like really obese. You can see over here, his skin folds can be completely appreciated, right? And it looks like a X-ray of a female. Okay, this is a young female. Of course, see her breast contour is very, very, very clear, right? So see, whenever I'm going to look at the X-ray, I am going to look at the costophrenic angles. I'm going to look at the apex. I am going to review this area behind the heart. I am going to look below the diaphragm, this areas. I am going to look for the breast shadows. Okay, these are called as review areas. Review areas, right? Number one is what? Costophrenic angles. Okay. Number second is apex of both sides, behind the heart. Okay, and below the diaphragm, and breast shadows. Okay, in females, like breast carcinomas, you can catch some calcinosis and stuff like this, or tumors. Okay, things like this. And the structures which you have to see overall in any chest X-ray, you have to look for always assess heart and major vessels, lungs and pleura, mediastinum, bones and soft tissue. Okay. Now, see, if you will go systemically, there is less chances you are going to miss any important detail. Now, the important thing over here is what? You have to assess the size of the heart, number one. You can assess the size of the chamber of the heart. You can assess the size of the pulmonary vessels. You can found any stents not shown here, or here of course, like you can see the sutures, right? Sometimes there are pacemakers, which is man-made. Sometimes you can see the heart walls if it is metallic. Okay. You can also assess the outline of um, aorta. See, this is the aortic knob. Simply, this is the aortic knob. Inferior vena cava and superior vena cava can be assessed as well. Okay. But remember, never ever comment on the heart size on AP chest X-ray, because in that one the heart is magnified, the heart looks bigger. Okay. So whenever you are going to, okay, wait, normal AP versus PA chest X-ray, CXR. Okay, see this one. This one is the PA, this one is the AP view. So of the same person, see how the heart looks like in this one and how the heart likes look in this one. So the heart seems a little bigger. See, you can see over here than this one, right? So never comment about the heart size on the AP chest view, because in this one the heart is magnified. Okay, or uh, see this one, the PA and the AP. So in the AP view, the heart is magnified. Okay, and see why the heart is magnified. You can see in okay, maybe I cannot bring it in this area, but I will try, because I told you, like, okay, it's coming. Okay, simply like see the in this one, in the PA view, the heart is here. Okay, like towards the film, and in, you can see in this one the heart is basically away from the film. So in PA view, the heart is towards the film. In AP view, the heart is away from the film. So see, when the rays fall, so it gives a bigger shadow, right? So that's the reason, guys. You can say whenever you are seeing, okay, yes, here you can see over here. See, in PA view, the heart is towards the film, so the shadow will not be so big, but here the heart is away from the film, so the shadow will be big. So remember, whenever you are interpreting AP view X-ray, never comment on the heart shadow, because it will be magnified. Okay. Uh, Now, what to assess in the lungs? In the lungs, you have to assess the size, any pathology you can see inside the lungs, like tumors, like in the apex, if you can see some shadows or things like this, and always see the helium. Okay. How to assess the pleura? Maybe in the pleura, you will found some calcification, some thickening, or maybe you will found some fluid or air over here in the case of pneumothorax. And one of the thing is mediastinum. So mediastinum, of course, including the helium. This is the helium, this is the helium. Or you can see like over here, this is the helium, this is the helium, right? So we assess the width of the mediastinum, we check the contour, we check the size and the density of hylia, and we check if they are symmetrical or not. And the last thing which I told you is bones and soft tissues, right? So bones and soft tissues, of course, I told you one of the thing is breast. If you can see any bony deformity like this one, see the clavicles look normal, they are symmetrical, they are quite normal, right? So this thing, so the bones all are normal over here. So simply like this is how we interpret a chest X-ray. By the way, we can write over here, for example, always assess the, I can make it a little bolder. Okay, so always assess the heart and major vessels. You can assess the size of the heart, You can assess the size of the vessels. Okay, you can check for any stents, any clips, okay, any pacemaker, okay, as well as you can check the aorta, okay, things like this. So of course, like other things, like I told you, I'm going to talk about the basic things. So this is the most basic things in lungs and pleura. Remember, we can also appreciate many things, like you can check for the size of the lungs, any pathology you can see in the lungs, any um, you can say lung markings you can see, right? And in the mediastinum, you can check the width of the mediastinum. You have to check the hylia or helia, right? Simply. And in the bone and soft tissue, you can check for the breast, you can check for the bones, you can check for the muscles, you can say, okay, muscles. Or sorry, in mediastinum, a very very important thing in lung marking is the presence of any air or any fluid, okay, any air or any fluid. And in this one, bone, muscles, okay, you can see all these things. So like these are the things, or these are the review areas which we have to see in the lungs x-ray, okay. Now talking about the x-rays and taking them further, so like chest x-rays are very 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 commonly asked to do. Okay, one of the thing is abdominal x-ray as well, abdominal x-rays. So in abdominal x-rays, simply what you can see over here is I'm going to include abdominal x-ray in front of you. So see, this is abdominal x-ray, right? Okay, abdominal x-ray don't have that much importance like chest x-ray, or you can say we have limited value in diagnosing than the chest x-ray. So most of the things we can diagnose on abdominal x-ray is like bowel obstruction. You can check for the stones present in the kidneys, okay, or in the ureters. And most of the time, abdominal x-ray is done to which we can guide us towards further investigation, like maybe abdominal x-ray can guide you to do a abdominal ultrasound, or maybe abdominal x-ray will let you do a CT scan, okay. So now one very important point, guys, remember, abdominal x-ray, okay, this is the anatomy, normal anatomy x-ray, right? That's what I'm including over here. Okay, abdominal x-ray, by the way, guys, they expose the person to much more radiations than as compared to chest x-ray. Simply, on roughly one abdominal x-ray is equal to 35 chest x-rays, okay. One abdominal x-ray is equal to, like, the radiation exposure is around 35 chest x-rays. So that's very important to remember, right? Like abdominal x-ray expose the person to much more radiation than the chest x-ray, okay. So see, you can see like the normal anatomy, we can see the lungs, we can see the ribs, we can see the vertebrae, we can see the air in the bowel, we can see the bones, ilium, sacrum, sacroiliac joint, pubic symphysis, okay, ischial tuberosities, femur. Now, kidneys images, you can see over here, there's a little darkened areas, kidneys, liver, of course, we can see clearly over here, okay. So, if there is fecal mass, we can appreciate that as well. So now, abdominal x-rays are also interpreted same like chest x-rays. There is no difference, especially when it's about interpretation, right? So we have to see the same thing. Either it's taken in the supine form, either it's going to take they have taken it erect form, right? uh, see, like this is too much white saying. This is they are showing you the leftover hair, right? So same thing that there. And in reality, you are going to find out the name of the patient, the age of the patient, how the film is taken. Okay. Again, one more normal anatomy X-ray, right? They are showing you the normal anatomy, which can be seen on the X-rays, abdominal X-ray, right? So now, um, how we interpret abdominal X-ray is simply uh, we are working with the same things, whitish and grayish and blackish colors, or you can say the shades of different things. So, uh, for example, this is black color, this is white color, and there is a lot of gray color. Okay, so black basically is gas. Okay, or you can say intraluminal gas. See, intraluminal gas. This is the stomach, so intra stomach gas. This is small intestine gas in that. So now gas inside abdomen is completely fine, but now I will show you something called as extraluminal gas. So intraluminal, like within the lumen. So of course, when there is um, extraluminal gas, so that where the problem arises. Now I will show you one X-ray. Okay. Okay. First of all, see, this X-ray is which one? Abdominal or chest? This is a chest X-ray, right? Now, see, when I'm going to look at the X-ray, what I am finding, like when I am going to check the diaphragm, I can see this liver shadow. I can see this stomach, air in the stomach. But what I can see, like, what is this? Or this one? Normally, if you will see, the diaphragm is completely attached with the liver. But here, what I can appreciate is there is gas under the diaphragm. This is very, very, very important finding, guys. This is called as gas under the diaphragm. Okay. So whenever this thing is present, remember that this gas, which is present in the intestines, due to perforation, it is escaped into the abdomen and it can be seen on the chest X-ray. It is called as what? Gas under the gas under diaphragm. So simply I can write over here gas under diaphragm. Okay. So this is an X-ray of gas under diaphragm, right? Okay. Now I will go back to the normal X-rays. Okay, not have to remember too much details, but normally the diameter of the large bowel is around 5.5 centimeter, and the small bowel is around 3.5 centimeter, right? So the presence of this gas basically in the intestines let us to calculate the diameter of them, right? And but this assessment is different, like changes between different people. But anyone, for example, in which like the large intestine is too much dilated, like 8 centimeter or above, of course it means like they have some pathology. Okay, so now how we can differentiate between the large bowel and the small bowel? Simply we see the markings, right? And how we see the markings, you can see over here. This one is small intestine, and this one is the descending colon. They are showing you here as well, or here you can see. Now I will show you some X-rays of the abdomen, and X-ray abdomen hostra. Okay, now see, when we do an X-ray of the abdomen, what you can see over here, the large bowel have hostra, these markings. Okay, now this one they only extend only a third of their way. Okay, they don't completely joined together. Okay, so this are called as what? Hostra, Haustra, hostra. So this is how we can catch, like either it's a large bowel or either it's a small bowel. So you can see over here, these are hostras. Okay, or you can see over here, Um, okay, these are called as what? Hostras. So they are present on both sides, okay? And the small bowel have valvula, valvula conniventus, okay? So the small bowel have valvula convent, okay, see this one. I want to show you some clear one. Okay, so this valvula conniventus, they transverse the small bowel along its whole length. See, the large bowel, they just come up till here or up till here. From both sides, of course. This one, they completely transverse. So these are called as what? Valvula conniventus. Okay. So now we can see a small amount of gases throughout the GIT. Okay. But for example, if we see gas, too much gas in the GIT, so of course, like it means that there is some sort of obstruction. For example, I will show you X-ray abdomen obstruction. Okay, obstruction. Okay, now see, these are all the X-rays in the obstruction. So you can see there is too much gas now. You can see like too much gas is there. Okay, or you can see over here there is too much gas uh, in the large bowel, right? So of course, like this one is basically called as um, air water level. See, this is air, this is water, this is air, this is water. You can see like these lines, right? So of course, like the water, of course, this one is erect X-ray. So see, this is air and this is water. So the water settle down, the air comes up. So this is what happened in bowel obstruction. Okay, there are multiple air fluid levels. We call it as multiple air fluid levels. And I told you about the gas under the diaphragm. Okay, so remember, gas under diaphragm is never normal, and whenever there is gas under diaphragm or there is extraluminal gas, so it means like they have some perforation, or sometimes after laparoscopic surgery, because in laparoscopic surgery they fill air in the abdomen, so it can be present as well. So this is what happens, or how we see the patient. Okay, and the whitish areas in this one is uh, okay. Sometimes we see too much whitish area. Basically that occurs due to calcification. Now you can see over here too much whitish area, or I want to show you some clear. Yes, this one. See, too much whitish area. This is basically calcification. Like calcified structures are often seen on the abdominal X-ray, and calcification could be due to gallstones, could be due to renal calculi. See, this is the kidney, and you can see multiple calcifications. Okay, calcification could be due to uh, lymph node calcifications and things like this. Okay, so they are the one which can be seen. For example, I will show you calcification of gallstones. Okay, you can see over here. Um, see, gallstones, right? Gallstones can be seen over here. So this is what can be present. And the soft tissues, they appear grayish color. Okay, the soft tissue, they appear grayish color. And of course, like there's a too much soft tissue in the abdomen, so of course you will find a lot of grayish in this one, right? So that's why abdominal X-ray is not so much informative, but what we is more informative. It can guide us towards obstruction. It can guide us towards stones, gallstones, and let us further investigation like CT scan, like MRI, like ultrasonography, and things like this. Okay, but if you are going to found too much whitish thing, so or very bright white thing, so remember that's an artifact. Okay, which could be anything. For example, what is this? See, these are some clips. Maybe this one is her dress. Okay, because if she have gallstones, so for sure she's a me female. Not for sure, like male also do have, but females have more. So maybe she's wearing a dress, and see, this is the artifact. Okay, so that's all about X-rays, guys. In the next lecture, we will discuss the CT scan things. I show you the X-ray of air under diaphragm in this one. If you want, I can include a few more X-rays like sorry, this is the same one. You can say I'm going to show you some more X-rays. For example, this one. Now, see, this one is a healthy person, and this is a person with tuberculosis. So you can see the here. See, there is nothing, but see here, there is some mass, right? One more X-ray I can include is see, the abnormalities in front of you, right? A lot of masses you can see, of course, like this. Maybe this could be a tuberculosis patient. Or for example, I can show you one more X-ray. Now see, this one is completely abnormal. So see, normally we should see this claustrophrenic angle, but see, all of this thing is fluid. So this is a X-ray of a unilateral pleural effusion, right? You have done pleural effusion, so that's why I show you this one. Like this is X-ray of unilateral pleural effusion. So thank you so much, guys, for listening. I will see you in the next lecture.